Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. With my courses, there is a 99% pass rate, and with my one on one sessions, I have a 100% pass rate since 2015. Now, you guys, I always like to go over the disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And as we continue our hypertension series, I wanted to give you a few more questions just because, again, I'm doing these series by the week so that you're able to see what I'm teaching you guys in a fashion for multiple perspectives so that, one, when you're reviewing, you know how to review. Two, that whenever you see it on the exam, you'll know how to pivot in those scenarios, okay? And I hope this is helping and benefiting you in these areas. Again, I'm just going down the path of things that I have noticed that are consistent areas where people commonly struggle, either in my one-on-one sessions and comments on questions, and hoping that this can help you guys navigate through it a little bit easier. Okay, so question number one. A patient presents to the office today for follow-up. The patient denies any complaints at this time. The patient denies any past medical history. Vital signs are blood pressure 122/82, respirations 20, pulse is 88 beats per minute, and the temperature is 98.4 degrees. Based on these findings, how should the nurse practitioner treat? Is it A, continue to monitor the patient is healthy and no treatment is warranted? B, initiate lifestyle modifications and chlorothalidone? C, initiate lifestyle modifications and amlodipine? Or D, initiate lifestyle modifications to include the DASH diet and exercise? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as the stem of the question allows you to slow down to ensure that you're answering what is being asked, okay? So here the stem of the question states, based on these findings, how should the nurse practitioner treat? And y'all, I get on this rant, and I know this is about to be really sidebar, but I just want to say this. I know y'all hear me say this over and over and over to read the stem of the question first. I say it every day on each one of these questions so that you can start to practice doing this so it's second nature. And I get on this soapbox. I was working, y'all know I do like question analysis sessions with reviewers, right? So I was doing a question analysis session yesterday with one of my reviewers, and I was telling her these things, and we're going over questions that she has completed, walking through to see where her gaps are, why she chose the wrong answer, and how to choose the right one. And the difference of reading that stem first versus not reading it. She hears me say this all the time. She knows it's a thing, but when she gets into it, she's just doing the questions. I know it. Y'all do the same thing. I was that person. But I'm telling you the significance, because when you get on the exam and you're trying to juggle all this stuff in your mind that you're trying to retain, processing through what they may ask you, and you start to read this fluffy scenario, and you go down this route that you think that they're leading you to, and you select the wrong answer because you were in that mindset. Reading the stem of the question first makes your mind kind of tricks your mind to say, hey, okay, this is what we're focusing on. So that's already in your head. So then when you go down the entire scenario, you know what you need to be pulling out and what you need to be focusing in on, and what is fluff versus what is necessary. So trust me, trust me, trust me when I say read the stem first. Apply that to your steps. All right. So anyway, based on these findings, how should the nurse practitioner treat? And remember, I always tell y'all, if they're asking for a treatment, run it back and see if they provided you with a diagnosis. If they have not, then you need to run it back a step further and look at the assessment findings. Okay. So here we need to go through the whole steps. All right. And I say when we're walking through our assessments, look to see if they provided you with an age, gender, ethnicity, because this will contribute greatly to how, when, and what we should do with diagnosis and treatment. Okay. But here it says patient came into the office today for follow-up. The patient doesn't have any complaints, doesn't have a past medical history. So now we're just down to looking at these vitals. Okay. Blood pressure is 122/82, so not terrible. Respiration is 20. Heart rate, temp, normal. So based on these findings, how should we treat? This patient looks pretty good, looks healthy. So here, honestly, you just want to make sure that you're initiating lifestyle modifications. And this is strictly because of the ACC and AHA guidelines, right? Because although all of this looks fine, you want it to stay there, right? And ACC and AHA guidelines, the first parameter is if they exceed that 120/80 range, you want to start to initiate the lifestyle modifications, right? So D is your best answer. Initiate lifestyle modifications to include the DASH diet and exercise, okay? And I know that question it seemed very simple, but I also don't want you to get so deep that you miss questions that are so simple. I want you to know how to address the simple, okay? Number 2, a 68-year-old female patient presents to the office for follow-up today. She denies any complaints at this time. Patient denies any past medical history. Vital signs are as follows on exam. Blood pressure is 136/92. Respirations are 20. Pulse is 80 beats per minute. And the temperature is 98.4 degrees. Based on these findings, how should the nurse practitioner treat? Is it A, initiate chlorothalidone? B, initiate lisinopril. C, initiate amlodipine. Or D, initiate lifestyle modifications and continue to monitor. Take a moment and tell me what you got in the comments, y'all. All right, here some of the question states, based on these findings, how should the nurse practitioner treat? Again, run it back and see if they provided you with a diagnosis. And if they have not, go back a step further and look at those assessment findings. Remembering, check and see if they've given you an age, gender, or ethnicity. Here, it lets us know that the patient is 68 years old and is a female. She comes to the office for follow-up, doesn't have any complaints or past medical history. Vital signs overall look okay, but that blood pressure is, something we need to pay attention to. It's 136/92. Your best answer here is D, to initiate lifestyle modifications and continue to monitor. Now, here goes the thing that I wanted to spin it and make you pay attention to. Because if you follow through with the questions and you've been on the series with us, on yesterday, this was question number 2 yesterday, but I slightly changed it for you because I want you to see it in all perspectives. Yesterday, this person had comorbidities, right? So if they have comorbidities and their blood pressure exceeds that 130/90 range, what do? We initiate medication therapy at that time, right? Not only did that patient have a comorbidity on yesterday, but they also were diabetic. That's what made us go with an ACE inhibitor. That was that best answer choice, right? Out of this scenario. If they didn't have diabetes or anything that warranted renal protection, you would have still treated, but you would have treated with a thiazide because that's your first of the first line therapies, right? But here, the reason why we would initiate lifestyle modifications and continue to monitor is because this patient is healthy. They do not have comorbidities. Remember, with our healthy population, we don't initiate therapy unless they exceed 140/90. So remember, I tell you guys when you're studying, and I added that my hypertension video in the description of our first one. I can add it here too if you still need to review over that to help you through the whole walk. But remember that I tell y'all that to know when to treat and then how to treat. So when 120/80, if we exceed that, we want to start lifestyle modifications. 130 over that 80 to 89 range, if they exceed that, we want to start medication therapy if they have comorbidities. If they are healthy without comorbidities and they exceed 140/90, then we initiate medication therapy, right? And then talk about how to, which medicines we use. So knowing when. So here, You want to still keep lifestyle modification. You want to start that. It's not time to give them medication therapy yet, okay? And the reason why for this, healthy people, they have less risk factors, right? So then we can allow for a little bit more wiggle room and hopes of improvement by lifestyle modification. Whereas people who have comorbidities already have increased risk factors. So we don't want to increase it more with the higher blood pressure reading. Okay. So that's why we jump to medication therapy at a lower reading for them. And then lastly, question number 3. A patient presents to the office today for follow up. The patient was seen 3 months ago in the office and his blood pressure was 124/84 and lifestyle modifications were initiated. Today, his vital signs are as follows: blood pressure is 126/82, respirations are 20, pulse is 80 beats per minute, and the temperature is 98.8 degrees. Based on these findings, how should the nurse practitioner treat? Is it A, initiate chlorothalidone, B, initiate lisinopril, C, continue lifestyle modifications and follow up, or D, initiate amlodipine? Take a moment and tell me what you got in the comments. All right, stem of the question. So, stem of the question here states, based on these findings, how should the nurse practitioner treat? Remember, they're asking for a treatment. Run it back and look and see if they have shown or provided you a diagnosis. If they have not, you're going to run it back a step further and look at the assessment findings, okay? All right, so we don't have a diagnosis. So let's see how this patient presented. A patient presents to the office today for follow-up. They were seen 3 months ago. Blood pressure was 124/84. Lifestyle modifications were initiated. Perfect. Now today, let's see how we're doing. Everything still looks good, but blood pressure is still exceeding that 120/80, right? So, in the event of this, you want to see continue lifestyle modifications and follow up. There's nothing warranting us to bump up to a medication yet. Remember when we treat. Remember your 120s over 80s, your 130 over 90, your 140 over 90. When we treat, how we treat, okay? Always picture it in that. So when you're approaching hypertension questions, ask yourself these things. All right, this is the blood pressure. Which range does this fall into? Do they fall into any of these categories that say there's treatment that is warranted? If yes, then move on to, okay, now how do we treat? And start to walk yourself through the different things. What are their ethnicity? What are their comorbidities? Because those are those main things that are going to let you know if you need to adjust the common first line therapies. Looking to see if they have any allergies. Looking again on those comorbidities, because are there any contraindications that we may treat with? So you want to pay attention to all of these things and factors when you are considering your hypertension management. Okay. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. Also, thank you for everyone who has been sharing. And for those of you who have subscribed, be on the lookout because there are some things up and coming for the subscribers as well. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864, or you can shoot a text message to this number, or shoot us an email at thenursingstudio1@gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option, both linked in the bio of this channel. If you are someone who prefers to study independently, my self-paced review is also linked in the bio of this channel. Um, if you're needing practice questions, those QBank options are linked in the bio of this channel. And then, if you're looking to book any of the one-on-one sessions, I always tell you guys to reach out. You can call, text, or email. As I like to gauge what you truly need, because I do have various one-on-one options so that we can make sure that you are enrolled in what's really needed for where you are on your review prep journey. So always reach out for that so we can get you booked appropriately. But as always, y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.